So I'm going to talk about the meta-analysis and system analysis of Cabinco, which is the drug I'm going to investigate. There were two meta-analysis and system analysis trials conducted. One of them is on 2021, October the 26th, the efficacy of abrocitinib for atopic dermatitis, meta-analysis of randomized controlled trials. This trial conducted a systematic review and meta-analysis to explore the influence of abrocitinib versus placebo on the treatment of AD. And the another one is on March the 16th, 2022. It's the systematic immunomodulatory treatments for AD, compared with dupilumab. Different doses of abrocitinib and other kind of drugs were associated with reductions in EASI scores for patients with AD. So I'm going to talk about the first one, conducted on 2021. The result of that trial shows that the abrocitinib exerts a favorable effect on the treatment of atopic dermatitis. So it's more about the efficacy. The method of this trial is two investigators independently search the following databases: PubMed, Embase, Web of Science, EBSCO, and the CL databases. The electronic search strategy was conducted using the following keywords: abrocitinib and AD. They also checked the reference list of the screened full-text studies to identify their potentially eligible trials. So as shown as the flowchart on the right side, a detailed flowchart of the search and selection result is shown. 152 potentially relevant articles were identified initially. Finally, 4 RCTs that met the inclusion criteria were included in the meta-analysis. Among the 4 studies included here, 4 studies report investigators' global assessment response and EASI 75, 3 studies reported EASI 90, and the NRS response. 3 studies report adverse events and serious adverse events. So the outcome data were analyzed with the random effects model and compared to the control group. For AD, abrocitinib results in a significantly higher IgA response with no heterogeneity among the studies, and with low heterogeneity among the studies. So the second meta-analysis is more detailed and more about the trial itself. So it's using the dupilumab as a reference standard. The researchers found that the JAK inhibitor abrocitinib edged out other competitors. Among patients treated for 8 to 16 weeks, abrocitinib 200 milligrams outperformed the reference on 4 standard outcome measures. The update included 60 clinical trials, 21 more than the original study, involving 16,579 patients with AD treated for 8 to 16 weeks. Data remained insufficient for network meta-analysis of pediatric patients for long-term outcomes, the researchers noted. So we're going to talk about the eligibility criteria and the screening and the abstraction process. Complete eligibility criteria has been published previously. They included the studies with children, adults with moderate to severe AD treated for 8 weeks or longer, and that at least 2 doses of systematic therapies with any competitor. So the severe to moderate AD is treated for the drug, the abrocitinib. For each outcome, they extracted data for short term, which is 8 to 16 weeks, and long term, which is more than 16 weeks time points. With each short and long term period, they extracted outcome data at the latest reported end point during the active treatment with initial randomization maintained. Active treatment duration was defined as the time from baseline to last administered dose plus the interval between doses. For outcomes, relevant data included the main change from baseline and a measure of variance. If data was not reported as change from baseline, they used the mean baseline and mean follow-up p-values. And let's talk about the data analysis. They performed random effects network data analysis for each outcome. They used non-informative prior distributions for moral parameters given current uncertainty of the relative effectiveness of the treatments. With each outcome domain, they analyzed each scale separately, but did combine different numeric rating scales if they access the worst of peak each. In separate analysis, they combine different scales within each outcome domain using standardized mean difference, SMD. They pulled studies of 8 to 16 weeks of treatment separately from studies longer than 16 weeks. They separated trials with adults from trials with children, but included 2 trials of abrocitinib versus placebo and 3 trials of abrocitinib versus placebo that included adolescent and adult participant aged 12 years and older in adult analysis. And outcome. Since the baseline review, they screened 1,431 titles, abstracts, and trial registry entries, and added 21 new trials of the total of 60 trials with 16,579 patients. Up to 16 weeks of treatment in adults. Abrocitinib daily 200 milligrams was associated with reduced EASI score slightly more than dupilumab, with 600 milligrams, then 300 milligrams every 2 weeks. However, the researchers also find that the abrocitinib 100 milligrams daily was associated with 2.6 times the odds of severe adverse events compared with the dupilumab, but the effect estimate was lower with credible intervals overlapping the null of abrocitinib 200 milligrams daily compared with the comparison. So that's the end of my presentation.